When seeing a dental hygienist, it's essential to know what to look for to ensure you're receiving the best care. My name is Whitney and I am a registered dental hygienist. Let's first talk about signs your dental hygienist is good. Green flag number 1, thorough examinations. They don't just clean your teeth, but their appointments also include routine periodontal charting, measuring your gum pockets, and oral cancer screenings, making sure you don't have any suspicious lumps or bumps. It's the standard of care for hygienists to not only clean your teeth, but to also check the health of your gums, surrounding tissues, and the bone that holds your teeth in, and the overall wellness of your mouth. Green flag number 2, comprehensive cleanings. Does your hygienist take their time to clean all of your teeth thoroughly, not rushing through their appointment every single time? If so, that's always a great sign. Now, I'm not saying it's inherently bad if they are fast, but if they are fast as well as not thorough, that's where the problem lies. Green flag number 3, patient education. Does your hygienist explain procedures, answers your questions, and provides tips for better oral hygiene at home? It's a very good sign if they do. And green flag number 4, personalized care. Does your hygienist tailor treatments to your specific needs and follows up on any concerns? Like, it can be as simple as asking if you're comfortable in the chair. Say you're 8 months pregnant or you recently had back surgery. Maybe they ask if you need a pillow. Common courtesy, accommodating your needs, personalized care. Now for the red flags. Red flag number 1, skipping perio charting. Like we mentioned, a good green sign is measuring your gum pockets, but a bad sign is not measuring your gum pockets. This could mean they're missing signs of gum disease. Now, if you're not sure if they check your gums, just ask. Maybe they just don't say them out loud to you, or maybe they haven't said much about them recently because you've had healthy gums for years and years and there's been no changes when they check, but they've still been typing it all into your records. That totally can be a thing, and they just don't talk about it with you that much because they once said they are healthy and nothing has changed since then. Maybe they just go no changes. But even if you have healthy gums, they still need to be perio charting routinely and putting it into your chart, into your records. So if you're wondering if they do it or not, just ask and go from there. Now, a big red flag with perio charting is, say you had a scaling and root planing and they haven't talked to you about your gums during any of your next maintenance and cleanings appointments. They just haven't talked to you about your gums. You had an SRP, a deep cleaning, and they haven't even talked about your gums since then. No, 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 no! After a scaling and root planing, after a deep cleaning, your gums should be discussed for a while, especially when you're deciding on treatment plans and maintenance scheduling. Red flag number 2, no oral cancer screening. Neglecting this vital check can overlook serious health issues, obviously. This goes for both dentists and dental hygienists. Red flag number 3, rushed appointments. Spending only 5 minutes on cleaning your teeth every single appointment, that can indicate inadequate care. The perio charting alone could take about 5 minutes, so I don't understand how someone is ever going to actually clean every single tooth surface of every single tooth in your mouth in that short amount of time. Cleanings are usually between 30 minutes to an hour, depending on if you count the exam and take into account all the other stuff in the appointment, reviewing medical history, taking x-rays, the dentist's exam, things like that. But overall, everyone is different. Some patients need longer appointments than others depending on the health of your gums. But regardless, the scaling teeth portion should never be less than 5 minutes, no matter how healthy your teeth are. It's more likely the actual scaling and cleaning portion to be between 15 and 30 minutes, even 40 minutes. This is just the scaling when they have the scaler, right? Depending again on the type of cleaning. And then another 20 to 30 minutes for all the other stuff that needs to be done in the appointment. By the way, when I said 15 minutes, again, I mean the actual time they have the scaler on your teeth. Most patients need at least 20 minutes or more. 15 is kind of pushing it. But some patients do have really extremely healthy mouths. So it just depends. Use your best judgment on if they are going really fast, doing a bad job, if your teeth don't feel clean after, or if your teeth are really, really clean already. So that's why it's quick. Red flag number 4, lack of communication. Not explaining procedures or not answering your questions thoroughly is definitely a red flag. Now again, some hygienists might just not talk much. That's fine. I'm not saying they have to explain every single motion their hand is doing while cleaning your teeth and always being talking to you throughout the entire appointment. No, I'm just saying if you ask a question and they say, I don't know, without even saying they will look into it or find out the answer for you, that can be a red flag. And please note, all of these red and green flags are not all or nothing. Every dental office operates slightly differently, and variations in care don't always mean poor quality. Sometimes the practice may not allocate enough time for comprehensive procedures, which can reflect in the services provided. So ultimately, trust your gut. You should feel comfortable and confident with your dental hygienist. Well, I mean, as comfortable as as you can be at a dentist office, right? But really, if something feels off, it's okay to ask questions and or seek a second opinion or choose a different provider. Quality dental care is crucial for your overall health. So don't settle for an office that's less than what you deserve. You see your dental hygienist for a longer amount of time than the dentist at your routine checkups. So make sure you are seeing not only a good dentist and a good office, but a good dental hygienist as well. I do have a dental office red flags video specifically for the office itself, which I'll link below. That goes more into infection control and a bunch of other things to look for in the office itself. This video that we just did here was specifically for dental hygienists. But of course, if your hygienist falls under any of the red flag categories in that video of mine, that's important to consider as well. I'll link it below. But back to this video, I hope it helped reassure you that you are seeing a good hygienist and that your hygienist has mostly green flags. And if you're still unsure about some of these things, just ask them at your next appointment. If you don't think you've ever had, say, an oral cancer screening, ask. Maybe they are doing it, but they just aren't telling you because they don't want you to be stressed over an oral cancer screening. Sometimes they will only tell you if they find something concerning. Just ask, because maybe they aren't communicating as clearly as they should. That doesn't necessarily mean they are doing anything wrong. But if you ask something like, do you check for oral cancer on me? And they say, nah, you're fine, you don't need to do that or something, or we don't do that. No, everyone needs an oral cancer screening. And for perio charting, checking the numbers, everyone age 18 and up needs a full mouth perio chart routinely. So if you're not sure if you're getting these things during your cleaning appointments, be sure to ask. Thank you for watching this video. I hope it helped you. Please be sure to like, subscribe, turn on your notifications if it did help you, and share this video if you think it would help someone else. And if you happen to be interested in getting into the dental hygiene career, you want to be a dental hygienist one day, I'll link my free RDH video checklist below. I get lots of questions in the comments and messages asking me how to become a dental hygienist. So whether you are in high school, college, or maybe some of you have already graduated dental hygiene school and you're looking for more information post-graduation, or you're looking for a career change, whatever the case, if you're interested in learning everything there is about the RDH career, be sure to click the link below. And until next time, I'll see you on Instagram at Teeth Talk Girl. Peace, love, and teeth.